Professor Sareen, Dr. Revari, Dr. Daga, the faculty, staff, students, and other ladies and gentlemen who are in this room. It gives me immense pleasure to be here today in this wonderful institution on the Hepatitis Day. And I had a few talking points that were sent to me, which I will not talk about after what Dr. Sareen beautifully explained. Almost everything around both prevention, management, not just of hepatitis, but of major liver diseases, including alcoholic hepatitis, fatty liver, and the consequences and cancer. So, just to say, I just want to add my voice to the fact that how important it is for us to eliminate hepatitis. As Professor Sareen and Dr. Revari, Dr. Thapa all have said, it is totally preventable and unnecessary deaths occur every year. So this is something which for me, for India to eliminate is just part of our journey to Viksit Bharat. If we want to be a developed country, we will have to at least do this much. So these are all, when we say Viksit Bharat, it is not something imaginary or something wonderful that will suddenly emerge. These small things that we all are facing, once we are able to get over them, it's only then we are going to become Viksit Bharat. Another thing that as Dr. Sareen said, I came here for the first time. I've never been to ILBS. I wasn't here when ILBS was established. I was at the World Health Organization from 2003 till 2022. And ever since I have been at ICMR, usually I don't like to go to any ceremonies and functions. And the reason is that I would like to actually dedicate my time, which is very limited. It's a tenure job, just like you all have tenure jobs, but your tenure can be extended. But for this job, the tenure is pretty fixed. So you have limited time. And therefore, I asked Professor Sareen when he offered that I could visit the facilities for research and meet the researchers. It was a great pleasure, and I said that I will come in the morning and first for half an hour or 45 minutes do that and then come here. So what I want to add is that the vision that Dr. Sareen has shown in not only having ILBS as one of the best clinical facilities and teaching facilities, but also one of the best laboratory facilities for research on liver diseases is so commendable. And so it is really worth watching. I would really commend you and appreciate what you have done within the government system, but created a different model of how things can be done. Indian Council of Medical Research has had several collaborations and several projects, including senior research fellows, research grants that have been won by ILBS and will continue to do so. The only thing I would like to say is, what I like is, and these 3 years what I have tried to do is, rather than give institutions priority, we have said that everything should be competitive. You must compete to get grants. And in fact, now if you get any grants, you can actually be proud that it is not because you are ILBS. It is because, or you are All India Institute of Medical Sciences. It's because you wrote a proposal and you wrote it in a way and you presented in a way, if it was a Center for Advanced Research, that you were selected by the Indian Council. I want to make it something which is worth being proud of. If you get even one ICMR grant, you should be very proud of that. And there are several that you have. So I am really happy to see that you all are. So we can only become, and my view is we can only become world class if we do that, if we can compete, if we can get the best research projects written, the best studies done, etc. So having more attention to how we conceptualize ideas, how big, how great the ideas are. So I was having a scientific advisory board meeting day before yesterday of ICMR, and I told them about what ICMR have done. Recently we have come up with a research and innovation, an ICMR research and innovation impact scale, and essentially have converted everything that you do, whether it is research publications, patents, use of research in public health, use of research in clinical medicine, use of research or patents converted into technologies and products, and even commercialization of products. All have been converted to one single currency, which I have called publication equivalent. And what I have started doing is now asking everybody to look at, when you get an idea, look at what do you expect, how many publication equivalents will it get when you are doing a research study, when you are making a proposal, what is the level of impact that you see. It's not, impact is not from publications. Impact is use of that research information and use of the innovations. So if you want to, it will come out in the Indian Journal of Medical Research soon. I would like you all to read it and think about it, that any research project you make, it should have a reasonable number of expected publication equivalents for you to succeed in getting, not only getting the grant, but also making your research more impactful. Because we do a lot of research in India. We publish one of the largest number of papers, but we do not do, a large proportion of it is not impactful research. It is research to tick boxes, research to get promoted. First you do research to do your MD thesis or your DM thesis, or you do research just to get a PhD. But when I compare all PhD students, there are some in this room, I guess. Please raise your hand if you are a PhD student. Yeah, there are a few. And there are many who are their guides. When I see a PhD student in India and I am told that अभी तो PhD कर रहा है, तो थोड़ा सा ऐसे ही project करेगा, थोड़ा low level, then I get very pained. Because when I see the PhD students in the United States, for example, they are doing things which are at the cutting edge of what research is being done globally. And ILBS is different in many ways. I saw this morning that you are involving your PhD students in cutting edge research. We should involve our youngest people, youngest minds in the best research that we are doing in our institutions. And I saw some evidence of that today. I am not sure it is 100%, but that should be our direction. We should get our PhDs and our DMs. So when you do a fellowship from Harvard or Johns Hopkins University, you are an accomplished researcher. Whereas when we do a DM, we are making our doctors, DM is a kind of a glorified MD in a specialized subject. It is the research which is the difference. You have such good facilities, and I'm sure your DM students, etc., are also, you told me that they are involved with some good research projects, etc. So this is something which we should all, from the very beginning, think about, that it's not enough to do research. We do research to solve problems. You do research to do exactly what Dr. Sareen said. We want to eliminate hepatitis. We want to reduce the cancers to a bare minimum. We want to reduce fatty liver disease. We want to test interventions that will come, which will solve the problems that we want to do. Also, I saw at ICMR in the beginning, there was so much of research that was just focused on describing the genomics, the proteome, metabolome, etc., etc. But we also need to then take that knowledge forward and find solutions to the problems that we are having, and that is where why I thought you got your Center for Advanced Research on Stem Cells and Regenerative Medicine, because you will be able to solve a problem of something that today we do not have a solution to, or the solution is very complicated or very difficult and people have to wait a long time to get that solution. So I just would like to encourage you all to keep working on research in addition to clinical care and training and teaching. And for those people who work on research, to think about the impact of your research. And I'm sure you all will go places. This institute has been really, it has taken off beautifully, and I hope that in the decades to come, it will become one of the most wonderful institutions of the country and of the world. Thank you. Jai Hind.